At Jessen Proton Therapy, we offer three distinct types of services. So today I offer architecture services, traditional architecture services, where I lead the team, I assemble the team. I bring in the engineers that are appropriate, the shielding consultants, and there are a few specialty consultants, and put the whole team together from the very beginning. With the owner, we select CM early. So the whole team works together. We design the project, we do the technical drawings, we go into pricing, into construction, but the project's not over at that point. When it gets to a certain substantially complete position, now we can start installing the equipment. Most projects don't do that. You're done at substantial completion. In this case, we're half done. We have a lot more work to do. Since 2017, we have been offering project management services for proton therapy centers. And that really leverages all the knowledge that I've gained in being an architect and designing proton therapy centers. You go through the whole process. Architects don't just design and then disappear. We actually take it all the way through construction and equipment installation, very importantly, and then commissioning to first patient treatment. Proton therapy project is very unique in its process. And if an architect hasn't done one yet, they may not really fully understand or appreciate the level of service and coordination needed during installation and after installation, commissioning, technical and clinical commissioning, to get to a point where the owner is ready to start treating patients. That lack of familiarity that some architects have with the process is why we started to provide project management services for projects we weren't the architect, so that then we could help navigate that process and offer advice about what additional services that our owners need to get from the architects ahead of time, and really coach the overall team about what to anticipate. If you have an architect that hasn't done a project before, that's okay. We can bring the expertise to the table and help navigate the process. But we can also provide coordination services with the proton therapy vendor, the manufacturer of the proton equipment. They are very important in the process. There's only a handful of them in the world that offer proton therapy. Of course, we know each of them, and we also understand what each of them needs throughout the entire process. So as a project manager, we can also provide that coordination effort, that if a team hasn't done a proton therapy center project before, we can bring that specialization. Then there's a third distinct service that we offer, and that is what we call SME, subject matter expert, for proton therapy projects. And that is an advisory role. And I have delivered it to institutions that had a favorite architect that they've worked with for years, or they want to add a proton therapy component to a cancer center project already underway, or there's a variety of reasons why they may want to use another architect, but that other architect may not have proton therapy services. As an SME, I can sit at the table with the owner. I can offer advice. It goes to design, construction, installation, technology, a lot of different areas that we offer advice. But really, it starts at the very beginning, planning. Even if I'm not the architect, I can work with the architects to make sure they understand the unique aspects of planning a proton therapy center.